Hi there, my name's Naomi Salisbury. I'm the Director of Self-Injury Support, and we are a Bristol-based but national self-harm support service. And I've been asked by Bristol Mind just to make a short video specifically for people who use self-harm or people who self-harm, to try and give a bit of information about what's going on right now and some thoughts and suggestions about how best to cope. I'm aware this will be really personal, it'll be very individual for each person, so we're not saying this is the right thing to do, this is the wrong thing to do, but just trying to give a sense of we're here, we care, you're not alone. We know that distress and self-harm and struggles with mental health do not go away because of something bigger happening outside that, and we haven't forgotten you and our services are still open. So essentially, what we have managed to find out about NHS services around mental health right now are that if you need treatment for self-harm, you should still seek that treatment. GPs are open, you need to phone the GP before you physically go in, but they are still there and they're still available, and as far as possible, the preference is to try and go to your GP surgery rather than a hospital. If you do need hospital treatment, if you go to an A&E, you will likely be assessed and triaged at the door of the A&E and sent to a bit of the hospital that doesn't have anybody in it who has symptoms of coronavirus. There's also, in a lot of places, mental health hubs are being set up, so if you don't need physical healthcare at that moment in time but you do need mental health support and assessment, there'll be a specific place to go for there. So these services are still functioning and the support is still there if you need it. We are really aware that a lot of community support has been stopped, and that makes it really hard work, really hard going when something you find useful and rely on has disappeared. So we do have some thoughts and suggestions about how you might want to cope or take things forward. So we totally understand that even with the information that we've given, you might not want to go to a hospital. The message we are getting from staff in A&Es and other places is that they are seeing far fewer people coming in for self-harm and for mental health issues, and they're quite worried about those people and where they are. So that is the general message that we are getting. But we understand that that doesn't mean that you will want to go anywhere near a hospital, and that's completely understandable. So the things that we would suggest are to think about how, if you may want to go down the route of trying not to self-harm, and then it would be quite useful to think about what kind of things will help you distract yourself, what might give you what might give you something useful that self-harm gives you as an alternative. And we don't mean things like elastic bands and holding ice cubes unless that works for you, but it might be things like battering a cushion. It might be, I know I've in the past hacked up juice bottles with scissors because it got quite a lot of, it gets to destroy something, but it also takes quite a lot of energy. So it's thinking about something that might have the same function or give you something similar without actually harming yourself. Some people try and delay when they feel the urge to self-harm, so they try and say, okay, I'll give myself 5 minutes, I'll go and do something else, see if I still need to do this, and the aim being to try and do something that is less damaging and you feel more in control. And so the other thing we would suggest is thinking about that harm minimization approach, that actually if you need to harm yourself, you do something that is as sort of low risk as possible. Obviously that will change from person to person and you may not be able to do that. So knowing about first aid and when you need to seek mental health and physical health help is really important too. The Red Cross has got great information about first aid, and there's no such thing as a safe overdose limit, and if you think you're going into shock, you should always seek medical attention. I think also in this situation it's really important not to underestimate the impact the whole situation's having. Even if your life on the face of it hasn't changed hugely, it's a very strange time to be living in. The whole country is going through a massive period of adjustment. We're completely lacking face-to-face contact with other people, and that's really hard. And there'll be times when you feel like you can really cope with it and times when you really feel like you can't. And we would just say be kind to yourself, validate how you feel. Just because you're one person and there's bigger things going on around you doesn't mean that your feelings aren't real and they aren't reasonable and they aren't valid in that moment. If you're just surviving, that is fine. There's a lot of stuff going around about learning a language and a new skill, and I'm at home trying to do my job, look after a toddler, and generally maintain some sense of being a human being. Believe me, survival is all that I am going for. If you can find one thing that soothes or nurtures you that you can do to try and make a point of looking after yourself, that could be a really great thing to do. I'm struggling at the moment to think of what I'm doing, which is not very helpful. But I know that actually, yes, I have put some very random games on my phone, and I'm making sure that I get about 15 minutes to play those before I go to bed at night, because it does help me unwind. And that is the thing that my day is working towards. Express yourself. We as an organisation don't talk about positive and negative emotions. They're all things that give you information and help you to express how you're feeling. It may be that you're into drawing and art or writing, but you may also just need to batter the sofa or shout at some random implements in your kitchen. But expressing that is completely valid at this point in time. Using grounding exercises can be really helpful, things where you're sitting on a chair and focusing on how your body feels, how pressing your feet on the floor, pressing your hands on the wall. Not everyone finds these useful, but some people can find them really helpful. And even just pressing hard with your hands against the wall, leaning your whole weight against the wall for 30 seconds, it's actually amazing. That does give quite a physical release. And last of all, you're worthy. We still care about what's happening to you. There are lots of people who still care. I've been talking to lots of people in mental health services, in public health, and everyone is, what we're talking about is how do we look after people's mental health for people who were already struggling. There is a lot of discussion going on. You haven't been forgotten, and please hang in there, and please get in touch with our services if you think it would be helpful.